Hello, I'm David Gdansky, and today we're going to discuss silica awareness. Silicon dioxide, also known as silica, is a natural compound made of two materials, silicon and oxygen. Crystalline silica is a dust form when working with sand, stone, concrete, brick, and mortar. There's some places that you can find crystalline silica, and they include construction sites. When you see the dust in the air in the construction sites, when they're kicking up the dirt, the dust, and all that. That's a form of crystalline silica. Oil field fracturing operations, cementing operations, things of that nature, uh, are places where crystalline silica can be formed and be found. Stone cutting shops, mines, and sandblasting shops are also, along with various others. Just remember, if you see dust in the air from rock, sand, brick, anything like that, there's silica in the air. Crystalline silica is also a known carcinogen. Repeated exposure without respirators have been known to cause cancer and silicosis. Silicosis is a long-term lung disease caused by the inhalation of large amounts of crystalline silica. And there's no cure for silicosis. Once you have it for life. Symptoms of silicosis include a persistent cough, persistent shortness of breath, weakness, and fatigue. There are three main types of silicosis, and these are chronic silicosis. And this is the most common form of silicosis. Chronic silicosis develops generally after 10 or more years of low-level exposure to silica. There's also accelerated silicosis, and this form of silicosis generally develops 5 to 10 years after exposure to higher levels of crystalline silica. And then finally, there's acute silicosis. This form of silicosis can form months or even weeks after experiencing high levels of crystalline silica and can lead to death in just a matter of months. And that's the most dangerous type. There's the treatments of silicosis. There is no cure for silicosis. However, there are some measures that can help alleviate the symptoms and improve the quality of life from those who do suffer from crystalline silicosis. Some of these treatments include ensuring that the individual is no longer exposed to silica. Man, that may mean changing jobs, finding something else to do. But you must, if you have silicosis, get out of that setting and find something else. Also, stop smoking. I think this is equally as important. You should really stop smoking whether you have it or not. But if you do have silicosis, it can really compound the frustrations of the disease and make life even worse for you. Regular tuberculosis testing, if advised by a medical professional, is something that you really need to do as well. And finally, regularly influenza and pneumococcal pneumonia vaccines are crucial if you have silicosis. Remember, silicosis is a respiratory disease, and influenza and pneumococcal pneumonia attack your respiratory system. So you need to make sure that you get those vaccines to minimize the risk of compounding those two things together. There are some ways of mitigating silica. There are many things that you can do to help with the mitigation of silica, including using proper protective equipment. That's one of the most important things that you can do. An N95 mask at the bare minimum. Still, if you're in an occupation where you are exposed to it for long periods of time, that is not enough. I would venture to say that you could use an N95 mask and get away with it doing some stone cutting at home. Things like that where you're just doing it for a few minutes and then you're done. You don't do it for weeks or months later. An N95 should be sufficient there. However, if you're making a living with it, it is not enough. You must get a minimum of half-face respirator with a particulate filter to ensure that it captures that. Now, the other things that I'm going to list are in addition to. You should always use a respirator, but there's also some things that can help as well in conjunction with the respirator, and that's limiting the time that an individual is exposed to silica. Also, make sure that there's adequate ventilation. Make sure that when you're using the ventilation, it's blowing away from you and not coming through you out the back shop door. That does you no good. That's just blowing it right into your airway. So make sure that you're mindful of where that wind in the ventilation is blowing it. Make sure it's going away from you, and also utilizing water sprayers. Water sprayers are good in the fact that it will capture that silica, it will encapsulate it in the water, and then the water starts to fall and drain, and it goes away. But nevertheless, your best measure is a respirator in conjunction with those other things. Now I have a doctor that's going to discuss some of the medical effects of silicosis.
I'm Dr. Edward Garman, and I'm talking to you about silicosis and the inhalation of silica particles into the lung. It's primarily a pulmonary disease related to dust exposure, and the dust can be from almost anything. It usually is related to people who've worked in mines or people who work in different occupations where there's crushing of rock and making of a dust. That becomes a fine thing, and then it's inhaled into your lungs. And once it gets into your lungs, it goes to the periphery of your lungs, your alveoli, and causes a fibrosis. And the end result is pulmonary fibrosis, which is bad COPD, and most people die of pulmonary complications. There's also an acute form of silicosis, which happens rarely, but a few people are exposed to silica and they get an acute reaction to it, and they become short of breath, and usually they do not survive very long, probably just a couple of years afterwards, and then they can be at a very young age and not have a huge exposure unless what I mean by a huge exposure, not over a long period of time, they could have a large exposure at one interval. There's also comparison that to the coal miner's disease or lung disease. Silica is a dust particle. The thing from coal miner's disease, which is inhaled, is a fiber, and that fiber causes fibrosis. So when you look at the lungs become hyperinflated, and you get, with silicosis, you get lymph node calcification. They call it eggshell calcification, and you get usually involvement of the middle and upper lobes with retraction. Many people who have silicosis also get tuberculosis, and that can lead to the demise from tuberculosis also as a complication on this silicosis. There are really no good ways to treat silicosis. The only good thing to do with silicosis is prevention. And prevention is by anything to decrease the exposure to it, to wearing a mask or facial protection things. Typically, I forgot to say that a person who has worked in the field where you have dust exposure or silica, they present with coughing, and then they present with shortness of breath, and it's just a slowly progressive disease. And different things are used to help these people, like inhalers and so forth, but nothing really can cure the disease or change the outcome.
So as Dr. Ed outlined, silicosis is a very, very dangerous disease. It's also a very preventable disease. So one of the, as I spoke of earlier, this is an N95 mask. For working around the house, this should be sufficient. And you take this mask and you put it over your head, just as so. You have a bottom ear and top ear, and the straps may differ by model. This is a 3M. And then you take this and you put it here. But this doesn't make a perfect seal. So you need you need to use a half-face respirator in an occupation. Now, using a half-face respirator, you must be fit tested. They have different sizes: small, medium, large, extra large, and so you'll be fit tested from a professional at your work or a contractor, and they will make sure that it fits around your face, and uh, make sure that makes a good seal. Also, when using those half face respirators or even a full face respirator, you need to be clean shaven. If you have a beard, it's going to let the particles in around there, and it won't make a good seal, which renders it fairly useless. So uh, there's some more information on the NIOSH website under Silica Awareness. That's a very useful resource, and it talks about different industries such as construction, fracturing, oil field, things of that nature. Um, and there's also some blogs on there. You can interact with some professionals and get some really good answers. So, thank you for your time and have a great day.